Today I'm going to be speaking about migraine headache. What is a migraine headache? A migraine is much more than a bad headache. In fact, it's a form of a neurological disease that can cause debilitating, throbbing pain that can leave you in bed for days. So, what is a migraine aura? Okay, what is an aura? An aura is like a warning signals that a migraine headache is about to begin. So usually the aura is commonly misinterpreted as a seizure or stroke. It typically it typically happens before the headache pain, but can sometimes happen during the headache or even after the headache. An aura can produce symptoms that might include seeing bright flashing dots, sparkles or light, blind spots in your vision, numbness and tingling can be some of the symptoms of it, speech changes, ringing in your ear canals, which is referred to as tinnitus. So another question you might want to ask me is, who gets migraine? And also, what are the risk factors for migraine? Number one, genetics. From research, genetics have been shown to play a major role in the acquisition of migraine, and it was revealed that up to 80% of people who have migraine headache have a first-degree relative with the disease. And also, the second thing is the gender. Migraine tends to happen more in women than in men, especially women between the ages of 15 and 55. And number three is the stress level. You may get migraine more often if you are stressed, okay? Which actually definitely shows you that, during the period of, every activity of just mental stress, even during mental illnesses, people can get migraine. And the fourth one is smoking. Okay. Now, someone might ask me, are migraines hereditary? Are migraines hereditary? Yes, migraines tend to run in families, which actually means that if one of your parents has an history of migraines, their child, which is you have 50% chance of having them. And also, if both parents do have a family history of migraines, it actually means that the risk jumps up to 75%. So another question you might ask me is that, can children get migraine? The simple answer is yes. But pediatric migraines, present differently, a little bit different than the adult migraine, and they are often much shorter. And the symptoms in pediatrics can also include stomach symptoms. Okay, so what are the symptoms of migraines? What are the symptoms of migraines? The primary symptoms of migraines is a headache. Okay, the headache is usually described as pounding or throbbing. This headache can actually begin as a dull ache that develops into the pulsing pain that can be mild, that can be moderate, and or severe. Okay, so usually if left untreated, your headache pain will become moderate to severe. Okay, if you treat it earlier, it can resolve being mild. Okay, and we need to understand that this pain can shift from one side of the head to the other side of the head. So what are the other symptoms of migraines? Other symptoms include sensitivity to light, photophobia, which is referred to as photophobia, sensitivity to noise, phonophobia. In this kind of situation, you see the patient just want to be in a dark room, or some people just want to avoid light. Okay, and also symptoms can include nausea, vomiting, and upset stomach and abdominal pain, which can be can be experienced in children as well, and also loss of appetite. And sometimes the patient can feel very warm, sweating, or cold with chills. Okay, so what are the management of migraines? What are the management of migraines? If you notice any symptoms of migraine, you should actually speak with your medical provider. So your medical provider would often, ask you questions and, prescribe, most possibly, prescribe medication. Medication that can be prescribed can be prescribed for the abortive or for the preventive. If you are prescribed an abortive medication, these medications are usually effective when you use them at the first sign of migraine. Okay, you want to take abortive medication when the symptoms is mild. Remember, when you don't take care of the symptoms when they are mild, it can progress to moderate and severe. And also preventive medications and can actually reduce the frequency and the severity of headache. Okay, medications are generally taken on a regular, and regular daily basis to help prevent migraine. I hope you're able to learn one or two things from my presentation. Do take care of yourself and be well.